Hi, I'm Dr. Kim. I'm one of the pharmacists here at healthwords. In this video, I will be discussing topical products. The skin is the largest organ of the body. People apply topical products directly on the skin on a daily basis for both cosmetic and medical use. Some of the more commonly used topical products are emollients and steroids, and they're sometimes used together to treat certain skin conditions such as atopic dermatitis. An emollient is a product that contains silicone, oils, or petrolatum. They hydrate and create a barrier, which stops moisture from leaving the skin. It's best to use emollients after bathing or showering, and then use twice or 3 times a day to keep skin soft and supple. The choice of formulation will depend on patient preference or the type of skin condition being treated. Lotions have the highest water content. They have a cooling effect when applied to the skin due to evaporation, but they're best used on hairy or large surface areas. Gels spread well, they're non-greasy, and they also have a cooling effect due to their water content. Creams are preferred by most people because they're easy to rub in and they can be used on most skin areas. Ointments are the most hydrating. They penetrate well, but they're greasy, they can cause staining, and they can be difficult to apply. But they may be preferred on particularly thick, dry, or scaly skin areas. If you're using several products, you want to start with those with the higher water content first. So you'll be starting with lotions, followed by gels, and then creams, and then ointments. So start from the lightweight or thinnest to the heaviest product. Wait 30 minutes between applying different products. Steroids can be used for short-term flares of skin conditions. If you're applying with an emollient, you'll want to apply the steroid first, and then wait about 30 minutes to make sure it's completely absorbed. And then you can apply the emollient on top of that. If you have questions about your topical products or any other medication that you're using, drop us a line here at HealthWords, or you can always talk to your local pharmacist. And if you have any queries, you can chat with a pharmacist now with our Pharmacist Live Chat.